Right now for you in Medical Rounds, Channel 3's Kara Sunland is talking to Dr. Michael Perkins, the medical director for respiratory therapy at Hartford Hospital, about the critical role of his department.
You know, a lot of people are concerned about what's coming next, but when it became clear that we were in the midst of a national pandemic, what steps were you already taking to prepare for your critical care response?
Yeah, thank you for asking. So here at Hartford HealthCare, we recognized very early on that we would have to take a proactive approach to planning for this. As we saw the infection roll out in China and Italy, the systems were overwhelmed. So we created a multidisciplinary team of our nursing leadership, advanced practitioner leadership, and leaders in the medical physician community in terms of our critical care council. And we created a COVID 2019 task force to enact a multi-tiered plan to build a larger network for ICU beds for our patients as the surge hit us. So currently we're operating at 3 times capacity and have plans to do more.
So what steps are you pursuing to protect patients and, of course, your healthcare team?
Yeah, so this is certainly a hot button issue. We have taken a system-wide approach of appropriately providing PPE for all workers in Hartford HealthCare, with a focus on N95s for healthcare practitioners that are exposed to large degrees of aerosols.
And right now you think you're okay with your PPE? I know everyone's asking for more, but right now you're doing all right?
I think we currently have an adequate supply, and we're certainly very thankful to the community who has been very generous providing us with resources. We would love any further donations of N95 masks, face shields, etc., and we are always looking for more.
So New York City and Italy have had difficulty with the volume of patients and the ability to provide ventilatory support. Is Hartford situated to meet this need?
Yes. So we actually are situated fairly well. Similar to the bed situation that we discussed, our COVID task force analyzed how many people we could ventilate. And through the foresight of our respiratory therapy leadership, we can ventilate close to 240 people relatively well. And so we're currently at around 37 to 40% capacity, so we have a large volume for growth to handle the surge as it comes. We also are experimenting with dual patient mechanical ventilation in our simulation center to hopefully double our need if that we reach that point.
People I know can help at home. What would you like to tell them?
Yeah, I think this is the most important thing. You know, we are here and we are happy to take care of you when you come into the hospital. I think the most important thing is that we really need to double down on social distancing at home. It's really important for us now as a community to take stock in being at home with our families and not going out into the community and exposing ourselves to risk. And this will hopefully help our healthcare systems handle the burden.